Choosing Wisely Philippines builds on work from the Choosing Wisely initiatives in the United States, Canada, India, and Africa, and aims to identify low-value and unnecessary practices that result in inferior outcomes. The Choosing Wisely movement is driven by physicians who identify common medical practices that do not offer benefits to patients and may cause harm. Choosing Wisely Philippines comes as the third Choosing Wisely campaign in low and middle income countries and the first in Southeast Asia. This Philippine Society of Medical Oncology, or PSMO, initiated campaign aims to facilitate a discussion among cancer treating physicians, including oncologists and non-oncologists, surgeons, paramedical staff in cancer care, patients, and policymakers. The discussions will focus on efforts to reduce the use of low-value practices across the country with an overall goal of providing the highest quality of care for patients with cancer. The Clinical Consensus Committee of the PSMO is the Society's arm in developing position statements that provide clinical guidance to its members. The 9 committee members are situated in the 3 different island groups of the Philippines to ensure representation of the different regional contexts and practices. The scope of the initial list of the position statements considered included practices from cancer diagnosis, treatment, and palliative and supportive care. The initial list was developed through a review of existing Choosing Wisely statements from other countries. New statements that apply to the practice of oncology in the Philippines were also provided by the PSMO. The committee used 6 major guiding principles in identifying the final list, which included relevance and applicability in the Philippine setting, published evidence of low value or harm, clarity of statements, cost, measurability, and frequent use in the country. A voting threshold of 50% or more was used to include an individual recommendation on the shortlist. And after a round of voting was completed, the committee further discussed each point on the shortlist and a consensus-based final list was created. The 10 Choosing Wisely Philippines statements are meant to augment the existing Choosing Wisely statements with specific Philippine context. The list includes, number 1, do not initiate cancer treatment without confirming the diagnosis, defining the extent of the cancer, and discussing the intent of treatment with the patient. Number 2, do not use serum tumor markers indiscriminately for the screening and diagnosis of cancer. Number 3, do not forget to discuss the value of biomarker testing for specific solid tumors where targeted treatments have proven benefits. Number 4, do not decide treatment of potentially curable cancers without inputs from a multidisciplinary oncology team. Number 5, do not use surgery as the initial treatment without considering pre-surgical or neoadjuvant systemic therapy and or radiation for certain cancer types and stages where it is effective at improving local cancer control, quality of life, or survival. Number 6, do not use combination cytotoxic chemotherapy when treating an individual for metastatic breast cancer unless the patient needs a rapid response to relieve tumor-related symptoms. Instead, use single cytotoxic agent. Number 7, do not use cancer-directed therapy for patients with solid tumors with all of the following characteristics: a low ECOG performance score of 3 or 4, no benefit from prior evidence-based interventions, and no strong evidence supporting the clinical value of further anti-cancer treatment. Instead, focus on symptom relief and palliative care. Number 8, do not use whole-body PET CT scans to detect recurrence after completing curative treatment for asymptomatic patients with early stage solid tumors. Number 9, avoid the use of granulocyte colony stimulating factor or GCSF for primary prevention of febrile neutropenia for patients with less than 10% risk for this complication. And lastly, number 10, do not forget to discuss herbal medications, including its potential harmful consequences while on active cancer treatment. Creating the Choosing Wisely Philippines statements is only the first step in efforts to decrease the delivery of low-value care in the Philippines, which will hopefully reduce the financial burden associated with cancer care. To further strengthen its reach, the PSMO, or the Philippine Society of Medical Oncology, in partnership with ecancer, will be crafting scientific modules of each of their key recommendations. Outputs of these modules will be presented through short video clips, which are easily understandable and shared across multiple media platforms. Furthermore, the PSMO and eCancer will be holding a 2-day summit in the Philippines on the first quarter of 2023, where multiple oncology practitioners and patient groups around the country will be invited to discuss the Choosing Wisely Philippines key recommendations together with other topics. And for this, we are very thankful to eCancer for reaching out to us and facilitating this endeavor.